Welcome back to World Health Plus Social Good and Day 4 at the World Health Assembly in Geneva, Switzerland. I'm Christy Feig, the Director of Communications at the World Health Organization, and I'll be your guide through the next hour as we look at some of the highlights today. It's been a very busy day. Both Committee A and Committee B are in full swing. The approval of the hepatitis resolution is one of the big decisions that's happened so far today, but there's a lot of other activity as well. We'll be talking with our technical lead about the hepatitis resolution shortly. We're also going to be talking about the post-2015 goals and targets. It was the theme for the technical briefing today. It's also a thread in a lot of conversation that's going on around the Assembly this week. Monday, in the Director General's address, she announced a new commission to address childhood obesity. We'll be getting a little bit more information about what that commission is and the extent of the problem that it looks to address. But first, let's check in with Sari Setyayogi from our social media team to find out what's going on the social media platform. Sari, thank you for joining us. How are people using Twitter this year at the World Health Assembly?
It's been very fascinating watching how people use Twitter using the hashtag WHA67. I think having been following the tweets through several assemblies, I think this year's assembly is probably the most active digital-wise. We're seeing individuals, we're seeing NGOs, medical students, they're all on Twitter, they're all tweeting live from different discussions, from different technical briefings and so forth. And we even noticed that there is a Minister of Health yesterday who actually taking questions on Twitter from World Health Assembly. So that's something that is really fascinating to watch.
Everybody realizes it's the platform to engage on.
Exactly, and we're also seeing a lot of people reaching out to us on Twitter, asking for like logistical questions. Where can I find this document? Where can I find a list of participants? That kind of stuff. Mostly are people from outside Geneva who cannot attend, but also some from the participants, the delegates. And so far the number today, we're seeing about 31,800 tweets using the hashtag WHA67. So that's quite interesting. That tells a lot about the number of people who actually tweets. And that comes from 9,000 Twitter users.
Wow. So it's quite a lot of activity there. Tell me a little bit about your team. How do you cover an organization or an event of this magnitude? I mean, the side events, the technical events, both committees, plenary. How big is your team and how do you do it?
Yeah, this year there are 3 people that covers from the social media team for this. And this year we really divide and conquer. There's one person who would basically go from one technical briefing to another, live tweeting from there, and also when there's a resolution approved. And then there's another who basically monitors all the conversation, responding to questions, comments. And there's another person who's basically our social reporter who's chasing the stories behind the scenes. So that's who we are.
And how long has your team been live tweeting the World Health Assembly?
Yeah, we started back in 2011, which was the 64th World Health Assembly. And I guess this is probably why at some point on Tuesday we made a mistake tweeting hashtag WHA64 instead of 67 because we are so...
Living in the past.
Exactly. Yeah, so we started in 2011, and then last year we introduced behind-the-scene photos on Instagram where we try to show pictures, stuff that delegates and participants could see, but people who don't attend assembly could not see. For example, the documents, how does it look like, the rows of flags, the lunch trays, and we tell it's like short story behind that. And this year we're doing this, the live streaming, and also we're trying to show, we highlight people behind World Health Assembly. So let us know, what do you think? We welcome your suggestion, comments, and all that.
And who is our backstory today? Who have you met?
Yeah. Here's Malik and Manu. They're from our IT support. They are setting a remote connection for our computers here. So if participants can use computers, it's thanks to them. And they're really like a Flash Gordon, because I tried to call them yesterday and somebody arrived within 2 minutes. I don't know how did they make it, but they're really on call.
They follow you on Twitter.
Probably. And the next person is Katya. She's from the inquiry desk, and I think probably almost all participants might have met her to pick their daily invitation, brochures, reports, and all that. She's very, very friendly. And this is her 10th World Health Assembly.
I bet that's a tough job.
Yeah, I think so. And she speaks French, English, and Spanish. And this is probably the guy with the best and most comfortable shoes in the assembly. He's Julien. He's from mailing. And he's basically delivering newspapers, urgent mails. So he's running around the Palais all day long, delivering to different offices.
I bet you he's been here as long as Katya has.
I think so too. So those are our people behind World Health Assembly for today, and they're still coming later this afternoon.
Super. Sorry, thanks for coming by.
Thank
Again,
you so much.
Tell them how to follow you.
Yeah, on Twitter we're at WHO. The hashtag is at hashtag WHA67, not 64. And on Facebook, we're facebook.com/WHO, and on Instagram, we're at World Health Organization.
Terrific.
Thanks, Christy.
Thank you so much. Sorry,
Thank
I
you.
appreciate it. And sorry, we'll be live tweeting the World Health Assembly. All the resolutions and decisions as they are taken, you will find out about them first on Twitter if you're not here in Geneva. One of those resolutions today was the hepatitis resolution. Now, there are 5 distinct types of hepatitis viruses: A, B, C, D, and E. But nearly 90% of hepatitis-related deaths are caused by hepatitis B and C, so that's a real problem in public health, and it's a real concern for a lot of the countries that are here right now. One of the biggest concerns about that, I think, is that it can be spread in health settings because it can be spread by bodily fluids. So we're talking about reusing syringes, for example. If medical equipment is not cleaned properly between uses, it could be transferred that way, also through the blood supply. Many countries here are now talking about the problem that they recognize they have there, and it's quite a hot topic here. So joining me now is the head of our technical work on hepatitis, Dr. Stefan Victor. Stefan, thank you for joining us.
Thank you for having me.
Why don't you just kind of start by setting up the issue for us? How big of a problem is hepatitis?
It's a major global health public problem. We estimate that about 1.4 million persons die each year from hepatitis.
Wow.
That's about a little bit less than from HIV, but more than those that die from TB or malaria. These other diseases get much more attention and more funding. So we're using this opportunity of the World Health Assembly to speak with leaders around the world to promote the WHO strategies on prevention, on treatment. You mentioned it's 5 different viruses, and there's a lot of different ways, a lot of modes of transmission. We know how to prevent it. We know that there's effective means for preventing hepatitis, either through the blood supply, from mother to child, by vaccination. The key is to bring those prevention measures to scale and do it where it's appropriate.
Hepatitis is sometimes referred to as a quote-unquote a silent killer. Why is that?
We call it a silent killer. Mostly it's because most of the infections are asymptomatic. It means you get the virus either early in life, and most of the hepatitis B transmissions are from a mother to a child during birth. And they're asymptomatic, and you stay asymptomatic most of your life. Over that time, the virus is slowly damaging the liver. And maybe when you're in your 30s, 40s, or 50s, you develop the cirrhosis or liver cancer, and that can kill you. So during that whole period, you have no idea that you have it. So it's really promoting education so that people know about it, that they get tested. Training healthcare workers as well is important to make sure that they think of hepatitis and they get tested and deal with it appropriately.
You mentioned how common it is. You mentioned that we know how to prevent it. What are the biggest challenges to addressing it then?
The big challenges are that it's multiple routes of transmission. So to properly take care of this problem, you have to assure safe water because it can be transmitted through water, hepatitis A and E. You have to have great vaccination campaigns to prevent hepatitis B transmission. All children, WHO recommends that all children be vaccinated at birth and 3 more doses in the first year of life. And that has brought down the rates of hepatitis tremendously, particularly in Asia, which have among the highest rates. You have to assure the safe blood supply to make sure that all blood units are properly screened with high quality tests. You have to make sure that injections are safely administered, that needles aren't being reused. Also, hepatitis B and C can be transmitted among drug users. And in fact, in some countries, most of the persons with hepatitis C are injecting drug users. So providing proper harm reduction methods, such as clean needles and syringes, opioid substitution therapy, is key. So you can see it's a lot of different things to get right. But some countries have done it, and we hope that through a concerted effort, through increased advocacy and awareness, that countries will be taking this problem more seriously.
WHO just recently released guidelines for screening, care, and treatment of hepatitis C. You just touched on hepatitis C there. Tell me a little bit about these guidelines. What do they call for? Why are they so important?
Yeah, there's a real revolution in hepatitis C treatment. This is a disease that affects between 150, or an infection that infects between 150 and 170 million people around the world. Now we have drugs that can cure 90% of them. There were no guidelines to help countries conceptualize and plan on national treatment programs. So we took under a process to develop WHO guidelines that covered not just treatment, because we are keen to make sure that countries think about this in a comprehensive way, that we think about prevention, about screening individuals, referring them to care, and then giving them the appropriate treatments. So it's more of a public health approach than some other guidelines that exist. Another thing is they're really targeted at countries that are low and middle income countries where almost no one gets treatment. So we've simplified some of the recommendations in order that they're more easily applicable in countries that don't have the resources that maybe some of the rich countries have. So we see these guidelines as really being an important tool that help allow policy leaders in countries that are hearing about these medicines want to think about how they can apply them in their own country. And this gives them a framework of how to think about it, which medicines have gotten the sort of WHO seal of approval, as it were, and that will help them to strategize it. Also, we hope it'll be a tool to try to bring down the prices of these drugs. They're wonderful medicines, they're very expensive, and so having an official document that recommends certain medicines can be an advocacy tool in negotiations with the pharmaceutical companies.
All right. We just got a questions here from our viewer online, and when these yellow cards are passed to me, that's what that is. The question that has come in is, will viral hepatitis be given much importance at the World Health Assembly this year? Where, as a matter of fact, it's gotten a lot of attention today, in fact, with the approval of the resolution on hepatitis. So why don't you tie all that together for me? Their question plus the question I have, which is, tell me about that resolution. What does it call for?
Yeah, we're very excited. We're very excited that this resolution passed. A number of countries have worked very hard to get a document that is really strong and that represents the views of all the countries. Brazil has led the charge on this, and we've been helping provide technical support. But the resolution, first of all, it really raises the profile of hepatitis and sort of makes the ministers of health and other leaders here call more loudly to WHO and other international organizations to do more about hepatitis. So it's really, in one way, a very important political statement. Secondly, it's a very comprehensive resolution. So it covers all those prevention interventions that I talked about, as well as treatment, as well as political engagement. So we hope that it'll really be, it's a call to action for us, certain things that we have to do at WHO, but also a call to action to member states, that what they should do to deal with hepatitis more comprehensively. One of the things that's highlighted in there, and that was really highlighted in the country comments that were made, over almost 50 countries spoke in support of the resolution, really showing how an important issue this is for so many countries. they kept coming back to the issue that we don't really have very good surveillance data. We really don't understand the problem in our country. So they're calling to WHO to help them develop standards for surveillance and provide technical assistance. So we're finalizing a document which will be a guidance document that will help do that, and we will provide technical assistance after that to try to help countries to think about how to collect the proper data so they can make the proper decisions in developing national hepatitis plans.
Well, my last question for you was going to be, this is certainly not the end of your work with this resolution. Where was your work going to go for the next year? But I think you just outlined that for me.
Yeah,
is there anything else you want to add to that?
I think our top priorities are working on awareness and the resolution will put us well forward on that. Working on the various technical guidance documents that will help countries in planning their national response, and also asking countries, and that's called for right in the very beginning of the resolution, is that countries should develop comprehensive strategies. Because right now hepatitis is a bit fragmented throughout the ministries, so to bring it all together with goals, targets, so that we can move this agenda forward.
I know we only have about 30 seconds left, but we just got another question from a viewer, so if we can answer it very concisely, I'd like to go ahead and get it in for them. And that is, what role do pharmaceutical companies play in hepatitis C?
Well, they play an absolutely critical role. They've invested billions to develop these wonder drugs. Now these drugs are there, and so the key for us, working with them and working with other donors, with other organizations, is how can we bring those prices down? We've made it happen for HIV, and I'm sure we can do it for hepatitis too.
Certainly an exciting time right now, especially for hepatitis C. Yeah.
It's extremely exciting.
All right, Stefan, thanks so much for taking the time to join us, and congratulations on your resolution. All right. The Millennium Development Goals are helping us reach for 2015, making the health progress for 2015. As that date approaches, though, there's wide debate as to what development goals the global community should aim for next. It was the theme of the technical briefing today during lunch, and it is a thread through many of the conversations here at the World Health Assembly. Joining me to talk about it, which will also show you how important of an issue it is for us, are three people. We have Dr. Anders Norrstrom, the Ambassador for Global Health in the Swedish Foreign Ministry, and definitely one of the leaders for health aspects of this discussion. We have Dr. David Evans, the Director of the Department of Health Systems Financing at WHO, and we have Dr. Rama Lakshmi Narayanan. It's a beautiful name. It's a beautiful name. You can mispronounce mine. She's the Senior Advisor for the Partnership of Maternal, Newborn, and Child Health. Thank you all three for joining us for this discussion. Anders, I want to start with you. Before we look to the future, let's start with where we are today. We're working towards 2015, and I know that you're somebody that was involved in the beginning of those discussions as well for the Millennium Development Goals. How have they done? What have they helped us to achieve?
I think we have achieved a lot if we look back now since the year 2000, both in terms of reducing maternal mortality. It's gone down with 47%. We have now almost not more than, which is one shouldn't say not more than, but 6 million children dying every year. If we look back, it was almost 14 million. We achieved a lot. HIV/AIDS, TB, malaria. Looking back, people were dying at that time. Today, people are surviving. Malaria being possibly the greatest success if we look back. So the MDGs has allowed us really to focus and to deliver on very clear results, mainly in terms of ensuring that people can survive. And
now, in the past 15, 20 years, we've also seen some shifts in the public health landscape as well, things that might need to be taken into account now looking forward. Reflect on that for me for a bit. What have we seen?
That is the reality today also of low-income countries, that they are faced not just with ensuring that you can survive the first year or the first months, but also that you need to stay healthy. And what we see today is an explosion of obesity, of diabetes, the so-called non-communicable diseases. If you take the cancers, one very concrete, I think, example that illustrates this is, and I sometimes use two curves. Maternal mortality is going down like this, come from 500,000, it's down to 287,000. Cervical cancers, also killing women, is going in the right opposite direction and killing exactly equal numbers of women today. We speak about maternal mortality, but we don't speak about cervical cancer. Roughly 280,000 women dying each and every year. The majority, absolute majority of those women also dying in low and middle income countries. So we have a double burden. The MDGs, but now we need to take on also the cancers, the diabetes, the coronary heart diseases that are killing people, especially when people are living longer.
So you've been doing extensive consultations over the past year or so, looking forward to what comes as far as health targets after 2015. Where do the consultations seem to be landing? There seems to be a consensus forming of the types of things that needed to be included for targets. What are you hearing?
I'm hearing that there are mainly 4 building blocks that we need to get into the future agenda, and I think there is quite a lot of consensus around those 4 building blocks. The acceleration and the continuation of the present MDGs, that is not done. Taking on the non-communicable diseases, or whether we're going to call them something else in the future, second building blocks, and we need to have both of them. And we need to package the delivery of both preventive, promotive, and treatment, and etc., supportive service within a framework of universal health coverage. More integration, more fair access to services, but also more fair financing. And then ensuring that all of that leads actually to us becoming more healthy, also moving them beyond the health sector. And that is possibly the issue where we're getting not enough traction today to recognize that if we're going to improve people's health, especially on the NCDs, we need to move and think beyond the health sector. People are still, especially in this place, still too much focus on their own business in the health sector. But what is going to make a difference if we're going to be able to make sure that people are getting healthy lives is what we do in terms of the right kind of food, physical activities, infrastructure, education, clean energy. That is really what is going to be making a difference on, especially on the non-communicable diseases. And that I think we're beginning to talk about. And that building block for me is possibly the most essential one.
Okay, we're going to come back to talk to you in just a minute, so don't go anywhere. But David, let me shift to you for just a second. Anders just mentioned universal health coverage. Why don't you start by talking our viewers through what is universal health coverage?
Yeah, I'd love to. The way I think about universal health coverage is what do you and I want from our health systems? What do normal people want from their health systems? They want the health services that they might need to use to be available, good quality, and affordable. That's the essence of universal health coverage. It's the aspiration that everyone can get the health services that they might need to use at a price that they can afford.
It sounds pretty simple, but it's quite challenging in reality. Talk about some of the challenges that countries face in trying to achieve this.
For some countries, it will be a relatively long path to move towards the full attainment of universal health coverage, because the resources available, the health workers that people might need to use, the medicines are not there because of low incomes. And so we call it a process of progressive realization that countries need to start, they need to know where they're trying to go, and move little by little, or big by big, if one can move big by big, to get to universal coverage as rapidly as possible. But it will be a process over time.
Dr. Chan, the Director General of the World Health Organization, has referred to universal health coverage as the single most powerful concept that public health has to offer. Why is that?
The reason why it's pretty special is that it's really all about equity. If you imagine the situation where everyone gets the health services that they need, everyone, regardless of race, age, sex, everyone gets the health services that they need, and no one is pushed into financial hardship because of paying out of pocket, it would be almost a revolution. It is all about equity, making sure that the poorest of the poor get what they need, as well as those of us that can afford it getting what we need.
I guess it goes back to a little bit of the concept Anders was talking about there, using health to connect, reducing poverty with sustainable development. I guess it kind of crosses some of those. All right, Rama, let me move to you. MDG 5, Millennium Development Goal 5, was focused on reducing maternal deaths. And while there is a lot of progress to celebrate there, we have a lot more work to do in really working to end preventable maternal deaths. What will it take to do this in the next 15 years?
Thank you, Christy. And I guess Anders very nicely spoke about what we have achieved, but what remains is the fact that in Nordic countries, a woman has a chance during pregnancy-related complications of dying of 1 in 3,300, whereas in some sub-Saharan African countries, it's closer to 1 in 30. So we do want to make sure that gap is reduced. Today, the world has a global maternal mortality ratio of about 210 per 100,000 live births. We'd like to cut that down by at least 2/3 to 70 per 100,000 live births. And we do think that's achievable if we take on some of the concepts that I think David already mentioned under the universal health coverage. Key ones being bringing about equity, and here I would define equity much more broadly. Not only in terms of income, but also gender inequities, in terms of location, that we make sure that women are able to access the quality care that they require, both before, during, as well as after childbirth. And here it's important also because, related to MDG5 is also the newborn mortality, which is currently captured under MDG4, but the mother-baby dyad should be held close together. And so we think that those interventions that will help the mother's survival and thriving will also help the newborn survive and thrive.
A group of UN agencies, governments, and other experts came together in April to develop the targets for the post-2015 agenda. Were the ones you mentioned just a moment ago the ones that they came to in April, or were there additional areas they sketched out?
Yes, one of them was the 70 per 100,000 as a global, but I think they did nuance it much further because there were a couple of issues, one around equity. Today, there are countries that have 4 or 5 times the global MMR rate, which is, as I mentioned, 210 globally, but there are countries which have more than 1,000. So what was discussed and agreed upon at this meeting, which had about 35 countries represented there and over 95 participants, was that we would also put a ceiling on what would be acceptable for no country to have greater than 140 per 100,000 live births as an MMR. So there was that equity aspect brought in. But I think the discussions was also about what are then the ways in which to achieve this. And some of the key things that came up was also effective coverage, which is one of the principles under the universal health coverage. So we really want to see quality in the interventions that are offered to mothers and newborns, as well as measurement, because we really need the data. Every death and birth needs to be counted and recorded so that we can improve it.
Rama, as you look across your area of work over the next 15 years, what else needs to be focused on and included?
Yes. I wanted to actually raise it when you spoke about MDG5 and maternal mortality. That is only one that's aspect of the MDG5. Actually, kind of later in the MDG process, due to a lot of very strong voices being heard, it was introduced, the universal access to reproductive health services, and this is something I think that is very critical for the next phase, and we need to make sure that maternal health is nested within this broader sexual and reproductive health services.
Super, Rama, thank you so much for your time. Anders, before I let you go, let me ask one more question. The discussions are still going on. It looks like opinions are starting to shape and consensus is starting to build, but walk me through now on the big picture here, the timeline moving forward. What is the process moving now for the next, say, 12 to 18 months?
What is happening right now is that there is what is called an open working group. That is a group where member states are meeting in New York. And they have a series of meetings leading up now to a report. There are 2 co-chairs, one from Hungary and one from Kenya, and they're going to deliver their report in July. But that's just a report. That is then going to be taken forward by the Secretary General and presented then to the General Assembly at the UN in September. That will then be the starting of the formal intergovernmental negotiations. So negotiations will start sometimes, I think, towards the end of this year, continue during next year, ending with a high-level meeting then towards the end of 2015, and hopefully then we will have an agreement on a very good agenda for development for the world.
Super. Thanks all three of you for coming by for this important discussion. We appreciate it.
Thank you.
All right. You see the progress that was accomplished through the Millennium Development Goals. That is why this is such an important discussion. Setting goals and targets like this can help us make incredible progress in public health and really get people on board working towards the same end goal. And that makes a massive difference in helping us make progress in some of the most important areas in health. Now, one of the things we just touched on in this last panel was non-communicable diseases, things like diabetes, heart disease, stroke, some cancers. A lot of it, as Anders mentioned, is from obesity and overweight, but we often talk about it in adults. One of the things that came up earlier this week when the Director General gave her opening speech was obesity and overweight in children, and she announced the creation of a commission. Joining me to talk about this issue and this commission is Dr. Gottfried Schwarb from WHO's Department on Chronic Diseases and Health Promotion. I hope I didn't abuse your last name there too much. You want to say it correctly for me?
It's Gottfried Schwarb, but
Yeah,
you did a very
see?
good job at it.
You can abuse mine. Gottfried, let me start with the big picture here. How big of a problem is childhood obesity?
Well, childhood obesity, Kirsty, is a very big problem now. If we look at the data, we had 31 million children under 5 in 1990 who were overweight or obese. This is scaled up to 44 million, so about a half increase by 2012. And we predict that by 2025, we would have 70 million children under the age of 5 who are overweight and obese. So the problem is big. Not only that, we know that for every child that becomes obese in the developed countries, 1 1/3 child, so more, become obese in the developing countries. In Africa alone, if we look at the data between 1990 and 2012, so a 20-year span, we see the number of obese children under 5 going from 4 million to 10 million. So the problem is big, and it's escalating at a very large scale. It also covers the whole globe. We're no longer talking about obesity as the problem of the developed countries. But as I mentioned in the data and in the numbers, the problem is getting worse in the developing countries.
Why is this? What's causing the increase?
Well, we're seeing a number of causes that are related to childhood obesity, but also to obesity in general. One is more people are living in cities. More people are living in what we call urban developments. So less opportunity for physical activity, more problems with regards to occupational time, so less free time, more children having sitting time, what we call computer time, face time, so less physical activity in children. And also our diets have changed. Our diets have changed from the traditional diets that included fresh fruits and vegetables to diets which highly processed foods. People are eating more fast foods. People are eating more from quick service restaurants, not just the big chains, but also those that are cropping up in lower middle income countries, the corner shops, the street food vendors. So this is one of the reasons why we're seeing an increase in childhood obesity and in obesity in general.
Why does it matter? Why does it matter if children are overweight or obese?
Well, it matters in the short term and it matters in the long term. And in the short term, we know that obese children have their own medical problems. We see problems with joints. We see problems with asthma. We see problems with timing of puberty. We see problems with regards to stigmatization because obese children tend to be stigmatized at school. We see problems of non-communicable diseases which are short-term and long-term. We know that an obese child tends to be an obese adolescent, which tends to be an obese adult. Now, the problem of non-communicable diseases, or the diseases that are more commonly known as the diabetes, hypertension, high blood pressure, cardiovascular disease like stroke, cancers, these have a big impact not only on the health system, because these cost a lot of money to the health system, but these have a developmental issue as well, because we're talking about these becoming problems not of old age, as they used to be 20, 30 years ago, but these are now problems affecting the people who are productive, the people who work in the country, the people who contribute to the development of the country. So the more we get these problems, the more the development agenda, the development of a country is either stemmed, is either stopped, or in a worst case scenario, it's reversed. So non-communicable diseases, which obesity is one of the leading risk factors, are going to shape the agenda, not of health, but of development of this world.
So the stakes are really high here. The stakes are quite high, I guess, to the extent that the Director General announced the creation of a commission to end childhood obesity. Tell me a little bit about the commission. What is the purpose of that?
Exactly, and the Director General, because of this problem, because this is an issue that is not only a health issue, but is a global issue of immense importance, has created this commission. A commission which will only have 1 year to report, so the urgency of it is shown in the importance of this commission's time frame. The DG wants this commission to give her the report so that she can report back this time next year to the World Health Assembly, and they will be looking at what are the actions, what are the interventions, what needs to be done, what has worked, and what can work in different scenarios. What are the combination of interventions that can be done in high-income countries, in low-income countries, in developing countries, in countries that are in transition. So it's got quite a big remit for these. The commission will be headed by Sir Gluckman, who is the senior scientist for the Prime Minister of New Zealand, and also co-chaired by Dr. Sania Nishta from Pakistan. So it encompasses with it a group of people who have various expertise in their own right, but to help them will be two expert groups, an expert group on science and evidence, and an expert group on implementation monitoring and accountability. And these groups will be looking at the science, looking at the actions, looking at accountability, because one of the main things that the Commission will look at is what should the DG, what should the Director General be proposing to countries, but also how do we make these actions accountable so that we reach, don't forget that in 2011, there was the high-level meeting of the United Nations where the heads of government agreed that they will work on non-communicable diseases. And one of the things that came out as a follow-up to this is that by 2025, we want to reduce premature mortality from non-communicable diseases by 25%. So we want to reduce the number of people dying unnecessarily from non-communicable diseases by 25%. And to do this, we need to look at the risk factors. Leading risk factor is obesity. And if we look at people who will be of the age for non-communicable diseases in 2025, these are the children of today.
Okay.
And this is why the Director General, first of all, the urgency, and secondly, why we focus on childhood obesity, because childhood obesity is making sure that the future is there.
That makes a lot of sense when you see it connected together that way. I have a yellow card here, which means that our viewers are asking questions,
Very
and
good.
we encourage them to do that. The question that has come in is, how can we address the determinants of health leading to obesity?
Very good question, because the determinants of health are, and this is one of the things that the Commission will definitely be looking at. When we look at prevention of childhood obesity, or the management of non-communicable diseases, we look at not only the biological factors, because there are biological factors that are involved, but we also need to look at the environment. The environment is very, very important. We need to ensure that we have an environment that helps the citizens, helps the consumers make the right choice, and make the right choice in being the healthy choice. So we need to ensure that the built environment is such that it helps people to be physically active. We need to ensure that food security is there to make sure that people have the ability, have the choice of choosing the right foods, the healthy foods. We need to ensure that children have an education that includes in it physical activity, that includes in it healthy eating at schools, that includes in it not only the safe and accessible water, and the safe and accessible environment, but also that these determinants, which are usually not at the forefront of the health scenario, because many of them are not within the health spectrum. So we're talking about a school that needs to have a playing field, or physical education being quality physical education in schools. It needs to look at other sectors. It needs to look at education. And this is again why the commission is made up not of scientists coming just from the health arena, but of people who come from a diverse range of arena, from the sports arena, from the economics, from the politics, from the socials, the socials side of the world, to ensure that the whole of society, because unless the whole of society works together, we will not resolve the problem of childhood obesity.
I think you probably just touched on this new question that came in. How will you combat obesity in regards to the restaurant business? But I think you really just touched on it there because you said it takes all people in a community working together, yes?
It does. And the restaurant business, we can't just hone in on one business. But if we take the restaurant business as an example, the restaurant business can still make a win-win for health. Because if a restaurant is offering healthy food, that is affordable, that is available, that is accessible, that is tasty. We don't need to have high-fat, high-sugar foods, high-salt foods to be tasty. Many of our traditional recipes are low in fat, low in salt, low in sugar, and are still tasty, and have been there for ages, and have been in our societies for a long time. So we need to look at how the restaurants can contribute to this. We're not saying that we're going to close restaurants. We're not saying that we shouldn't be eating out at all. We're not saying that these businesses are against us. On the other hand, contrary to that, we're saying these businesses are part of the solution to the problem. And we need to all work together to ensure that they also contribute to the health environment of the population.
I think there was so much viewer interest because it started to get really personal there. I think it really speaks to how engaged and how...
And this is also why it is not just the individual's choice, but it's making sure that the individual's choice is made in an environment that is conducive to health. So everybody has to put in their little bit so that the whole of society works together, so we do reach the target of reducing premature mortality.
Super. It sounds like something well worth everybody participating in. Godfrey, thank you for coming by.
Thank you.
I appreciate it. I know you have a lot of activity right now in Committee A, so I'll let you get back to that. The Commission will be beginning their work this summer. One of the working groups that he mentioned will meet first, and then the whole Commission will come together and start their work. It will turn around a report in about 12 months. So it's well worth staying engaged, keeping abreast of it on our social media platforms, and as always, getting engaged in your communities. Now, every year on the 7th of April, WHO celebrates World Health Day. It's our birthday, really. But we use it as an opportunity to call attention to a very important health issue. This year, it was what we call vector-borne diseases. Now, my next two panelists are going to be spending the next 10 minutes talking to me about this. We have Dr. Fatoumata Nafou Traoré.
Yes.
Yeah, did I get that close?
Absolutely correct.
Wonderful.
How are you?
That's the first complicated name I've gotten right today. She's the Executive Director of Rollback Malaria Partnership. And we have Dr. Raman, hang on, let me try. Velayadin.
Yeah.
Seriously.
Perfect.
Did I really? You're just being generous.
No, no, okay.
Wonderful. All right, since I did well, I'll be nice with my questions then. He is the coordinator of the Department of Control of Neglected Tropical Diseases at WHO. Raman, I'm going to give you the tough question because it's the first question here, and that is, what is a vector-borne disease? And when you answer that question, you're going to have to explain it to our viewers without using the word vector.
Yes, the vector-borne disease is essentially, vectors are nothing but organisms which transmit a pathogen or an infection from one person to the other. So these are live organisms, mostly insects, which pass certain infections, maybe parasitic or viral, from one person to the other. So vector-borne diseases refers to the group of diseases where such transmissions occur.
He did very well. He did well with that, didn't he? All right, we'll jump to the easier questions with you now. Dr. Nafo, tell me a little bit about the vector-borne disease that you work with all the time, with malaria. It was so important that it's been listed in the Millennium Development Goals. Talk about where we are today with malaria and the progress that we've made.
Yeah, thank you very much. Malaria is definitely a disease that is transmitted by a vector, which is an Anopheles. And for the last 14 years, we've made a tremendous progress in malaria control, reducing the burden of the disease in terms of mortality by 45% worldwide, and in the African region by 50%, which is really incredible if one look at the level of funding that is going to malaria. We were hoping that on annual basis, 5 billion would be invested in malaria to get to universal coverage. Today, 2.5 billion is getting invested. With half of the resources, we managed to reduce the burden of the disease by 50%, particularly in the African region. So we need really to celebrate that.
Really remarkable. How did we do it? What were the biggest steps in making that progress?
Funding has been critical when we got a really huge investment in malaria control, moving from 200 million per year in 2004 to currently the 2.5 billion I'm talking about, thanks to the global funds, thanks to the US PMI and DFID and some of the banks and the Gates Foundation's investment in malaria control. But innovation has made it also, with new insecticide-treated nets, with new medicines, with the artemisinin combination therapies, but also because of the fact that malaria can be, the rapid test is available, and one can be tested even at village level with less professional people. Let me say just a village level worker can do it and tell you if you have malaria or not. So bringing all those things together has helped us to know who is suffering from malaria and give them the life-saving commodities to ensure that we're doing the right things at the right time in the right places.
Looking forward, what concerns you? What are the challenges ahead?
We have two big challenges in malaria control currently. The first one is lack of sufficient resources. As I said, half of the resources needed is made available. Then we have to continue mobilizing resources because we know that the world is becoming richer and richer. And we hope that more will really get to our point and understand why it is critical to invest in malaria control. That is one important issue that is challenging malaria control. The second issue is related to the double resistance that we're facing, resistance to of the vector to the insecticide currently available, and also the resistance of the parasite to the only class of drug, which is artemisinin combination therapy, that is available for malaria control. So those are the two main challenges, and we hope that with research and development, we'll be able to have new classes of drugs, new insecticide to take malaria control to another level of fight.
Looking ahead this year, Rollback Malaria is leading an effort to update and evolve the Global Malaria Action Plan. Perhaps that speaks to this, but tell me a bit about this plan and where you're going with it.
Let me first start with our current plan, which was developed in 2008 for 10 years. But we've seen that with that plan, we really created a framework for coordinated action. So today, we're developing the second generation in coordination with WHO, who is developing what is called GTS, the Global Technical Strategy for Malaria Control and Elimination. Those two documents should be seen as companion documents, one providing the technical background, policies and strategies, and the Global Malaria Action Plan is the one to tell us how to scale up malaria control in bringing together all partners, private sector, NGOs, research and academia, endemic countries themselves, so that really malaria control is not siloed, it's not left to Minister of Health only, but we look at it as really an issue for development. And if one look at the link between malaria and development, yes, we can understand why we have to go for a multi-sectoral approach to malaria control. And this is why really we're developing this second generation of Global Malaria Action Plan, which is really being done in a very, very participatory manner, very inclusive, from the regional consultations to the country level consultation before we came back at the end of the year to really compile all the information to be able to say, okay, here is the first drafts to be made available to social media, to anyone who wanted to comment on it, so that really what we develop finally became something owned not only by us as technical people or as RBM Secretariat, but by all people interested in malaria control, because it is critical. It is really critical to invest in malaria if one has to fight against poverty, because malaria and poverty are very, very, very well interlinked. If we wanted to reduce infant mortality, we have to reduce malaria, because 20% of the child mortality reduction is due to the investment in malaria. So it's very important.
So the cross-cutting aspect, and I think you just spoke to all the important partners that you work with to do that. I think it's very clear. It takes partnership from everybody. Raman, let me shift to you for just a minute. I want to talk to you about another vector-borne disease, dengue. Tell me a little bit about dengue. Why is it such a problem today?
Dengue is basically a viral disease which is transmitted by mosquitoes, which are pretty different from the Anophelines. And this is transmitted by a mosquito species called the Aedes. The uniqueness of this disease is that it is more urban, and the mosquitoes live in an urban environment. They bite humans during the daytime. Their eggs can withstand desiccation. And these mosquitoes are unique in a sense it likes to bite as many people as possible during a course of a blood meal. So all these makes dengue more widespread now. It is the fastest growing vector-borne disease in the world, and it is now affecting almost 3.5 billion people are at risk of it, and around 120 countries are exposed to dengue. Added to that, this vector has spread along with urbanization. It has adapted well and spread to many urban cities. So this is the fastest growing disease.
How do you protect yourself from dengue? We know we've got insecticide-treated bed nets for malaria. What's the equivalent with dengue?
Well, essentially, the vector control for dengue is more focused on personal protection, as well as making sure that you don't, as well as source reduction in the houses. In a sense, we make sure there is no stagnant water in and around the houses. So personal protection measures can be repellents, coils or aerosol sprays, which we use on a routine basis at home.
Recently, we've been hearing a lot in the news about dengue related to the World Cup. What can you tell me about that?
Essentially, the Brazil as a country is endemic for dengue, and Brazil has been recording a lot of cases of dengue. And visitors going to Brazil, especially the cities where there are cases of dengue, are at a risk of dengue. But having said that, the government has done a huge amount of effort right now, and there has been 80% reduction of dengue cases, especially this year. So this is a remarkable achievement, and I think during this campaign they will make sure that the places are essentially free of mosquitoes. But it's good to take the preventive measures.
Why is dengue on the rise? Why is it spreading?
Essentially, the challenge of dengue is, it is again related to resources. We have very limited resources invested on control. Vector control tools are partly effective, and there are some new tools coming up on the horizon. So the issue here is how effectively we can bring all these tools together, put adequate resources and coordinate efforts. So there is a need for greater coordination, greater amount of resources to address this growing problem.
Recently, and I guess in the past 10, 15 years, dengue's been spreading to more countries. Kind of paint the picture for me. Where is it now?
Before
spreading to?
1970, dengue was present in only 9 countries, mostly in Asia, Southeast Asian region. And after 1970, it has really spread to almost 120 countries right now. It affects all parts of the world, and even Europe is at risk of dengue because we have had dengue in Italy, France, and a couple of other countries in the last couple of years. And in fact, Portugal, in Madeira Island, they had a big outbreak of more than 3,000 cases last year. So the risk exists all over, and even Florida had cases. So dengue is fast spreading in all continents, and this goes hand in hand with the spread of the vector or the mosquito.
What's your advice for people as they travel?
Well, the travelers, it is the main advice is to read about dengue and take the basic precautions to prevent mosquito bite, including the use of repellents, long sleeve clothes, and make sure that you really don't get bitten by a mosquito during daytime. And in case you get fever within 10 days on your return, it is always good to tell the doctor that you had been to a dengue affected area, so that makes the case management more easy.
So dengue mosquitoes bite during the day,
Malaria mosquitoes during
bite
the
at
night.
night. I have a question from a viewer for you, Dr. Nafo. Our viewers are allowed to ask questions. We highly encourage it, and one has sent in a question for you. What will happen with malaria in the post-2015 agenda? So looking forward over the next 15 years, where does malaria come
That's
in?
a wonderful question, and I really thank the person who sent out this question. And I wanted the person to go to the website, UN website, and really share his or her views really with the open working group on the sustainable development goals in order to get the malaria voice heard. We're not hearing many voices on malaria and sharing their concerns and views. What we're doing is that we all know that we consider the MDGs, the current MDGs, as unfinished agenda. So we hope that this element will be kept and that we'll continue doing the wonderful work that has started to control malaria. The second thing is that universal health coverage would be an important element that will encompass all the diseases, including communicable, non-communicable, and neglected tropical diseases. And for me, the most important thing, if we say in the post-MDGs agenda that we shouldn't leave no one behind, that is a powerful message. It just means that we have to put human capital, people at the center of the action, and whatever is happening to anyone, anywhere, as a health professional, as leaders, as communities, we have to ensure that wherever they are living, they are getting the right services so that we continue again and again to save lives, because this is why we are there as health services, and as leaders, we have to ensure that we continue investing in life saving, and we will continue doing that.
Putting people at the center of action, that is so powerful. Thank you for that.
Thank you. Thank
We
you
have
very
one
much.
last question from our viewer. Raman, we'll give it to you. How do you get rid of mosquitoes without damaging the ecosystem?
It's a good question, but having said that, we would find it very difficult to get rid of mosquitoes. All you can do is to reduce their population by managing them and controlling them. And there are means, as I said, in terms of source reduction, preventing breeding sites, or covering water containers and so on, so that they don't have a chance to breed in and around houses. So by that, you can reduce their population and keep it in a manageable level. To get rid is a long way off. It will take a lot of planning.
All right, and you'll keep working on that.
Yes.
Thank you both very much for taking the time to join us. Thank you
Thank you.
very much, as are you. All right, that's all we have time for today here on World Health plus Social Good. The activity is really picking up here at the World Health Assembly. Both committees are turning out a lot of work right now. We may even be looking at some evening sessions tonight or tomorrow night. All the work must be done, though, by midnight on Saturday. Tomorrow will be our last day on World Health plus Social Good. We'll be talking about the importance of good nutrition in health. We'll be talking about the health aspects of indoor air pollution. A report that was released not that long ago really shed some light on the magnitude of that problem. And we'll be talking about how mobile phones are playing a role in improving health. We'll wrap up the day by talking about what happens after the World Health Assembly closes. How does the decisions and the resolutions that are taken up here turn into reality in day-to-day life? We'll have one of our regional directors join us to talk about that. That's all for today. Thank you for joining us on World Health plus Social Good. I'm Christy Feig.